Yes.
So we're going to have the humerus connecting with the radius and the ulna. We're going to have some ligaments. We're going to have a joint capsule. Okay. So we're going to have a humeral-ulnar joint and a humeroradial joint, and this is really the more significant of the two. In the forearm, we're going to have a proximal and a distal radial-ulnar joint. So at the elbow, we know that it's uniaxial, so that means it's got 1 degree of freedom, so it's flexion and extension. That's all it does. Okay, so if you start talking about rotators of the elbow, you're wrong. Huh? Yeah, you're wrong, or you've been a bad accident. Okay, normal range of motion should be 0 to about 145 degrees. And again, that flexion number is going to be dependent on the individual. Depends on their soft tissue approximation, right? Okay, and that's going to give you a soft end feel. So we say that the resting position is about 70 degrees of flexion. That's what that means. 70 degrees of flexion and about 10 degrees of supination. So it's just, you know, you're going to, as you're just relaxed, it's going to be kind of like this, you know, like as you're sitting in your chair or whatever. That's just sort of a position of rest. A little bit of supination, a little bit of flexion. Flexion in the elbow, supination. You're doing this. Supination is this. She's like, okay, I got it. No, you're not a bunny rabbit. Okay? Yeah. Sorry, didn't mean to pick on you, but I didn't want you to get it wrong. Okay, so here's our pictures, flexion and extension, you know that. Okay, ligaments and other structures, and I'm not going to pound on you too hard about these ligaments, but you need to know that they're there. So we've got our joint capsule, of course. Okay, we've got medial collateral ligament provides medial stability, lateral provides lateral stability. So you've got ligaments on either side to kind of keep that unexpected rotation from happening. Okay. And then you've got what we call an annular ligament that holds the radius against the ulna.
Is that the space
That's
between?
this one right here, huh?
Was that space in between, or is that a tendon we were talking about? Like
No,
when you're
it's a
showing
ligament.
this?
It's a
Oh, it is
ligament.
that?
Let me show you what that looks like on each guy. So where we're talking about, and I think it's hard to see in the picture, but where we're talking about, here's our radius, right? Here's that radial head, so we know that that rotates around. And so that annular ligament is like a, it's like a loop that goes around that to hold it up next to the ulna for that rotation process. Okay? That's just what holds that in place so that rotation can occur. Uh-oh.
That's the annular ligament.
You're going to start encouraging me to read tab. Okay, interosseous membrane. So that's going to be that broad, flat membrane that I was telling you about that goes between the radius and the ulna. Okay, so it keeps the radius and ulna kind of together. It actually serves as a place for muscles to attach. So it's like we can't see that on him because he doesn't have that. Okay, put you back together, buddy.
This is his good arm.
Yeah, this is
Not doing so.
Oh.
Oh.